All right, so we're going to start with the ankle assessment. So first thing you want to do after you've asked your history questions and done an observation on the injury is to do active range of motion testing. So we're going to test both the non-contractile and contractile structures around the ankle working together. So first thing we want to do is active dorsiflexion. So bring the toes up all the way. We can stand over to the side and make sure the range of motion is the same. Then we can ask them to point their toes down as far as they can. And of course, every time they do a movement, we want to ask if there's any pain. And if there is pain, we want to ask them questions about the location and the quality of the pain. Once they've done plantar flexion, we can get them to turn the soles of their feet inward. This would be inversion. You want to make sure during inversion they're not moving at the hip and that the movement is coming solely at the subtalar joint. If you need to, you can guide their feet and then just let go as they do the movement. Then we want to do eversion, okay, turning the soles of the feet outward. So assuming those are all okay, we can then move on to passive range of motion testing. This is where we're testing the inert and non-contractile structures. So just maybe bend one of them, yeah. Okay, so first thing we're going to do is cup the heel. Okay, we're going to go into dorsiflexion. My other hand is on top of the joint because I want to be able to feel if there's any cracking or popping or any kind of sounds underneath my hand in the ankle joint. So we're going to come all the way up and then down. And we're going to do it 3 to 5 times. We want to get to the very end range, okay, and really stress those structures. Then for plantar flexion, I'm going to put my hand on top of the foot. I'm just going to point down and then bring it back up. So the whole time my other hand is staying on the joint. And I'm just feeling for the quality and looking at the quantity of movement passively. So we would then do both sides. Then for isometric resisted testing, this is where we're testing the muscle strength around the ankle joint. So I'm going to start with dorsiflexion, so testing the muscles of the anterior compartment. So I'm going to put my hand here, okay, and I'm going to say to the person, don't let me move your foot. So I'm pushing down, okay, he is pushing up, and relax. We want to hold that for about 5 seconds to make sure we get a really good read on what their strength is like and if they have any pain. Then for plantar flexion, it's easy if you get them to kind of step on the gas pedal. So push down. So we're testing the plantar flexors here, both the deep and superficial groups, relax. And then we're going to do inversion and eversion. So this other hand here is just stabilizing the ankle and the foot. It's not really there the same way, for the same reason it was for passive testing. So here I'm going to put my hand on the inside of the foot and I'm going to say push inward against my hand. Okay, so here I'm testing the inverters, which is tibialis anterior and tibialis posterior. And then I'm going to switch my hands and say push out against my hand. And relax. And that one is testing the peroneal muscles. Then we're going to move on to special tests. So we have a couple different ones with the ankle. Let's maybe use the other foot so I can see a bit better. Okay, so the first one is going to be the drawer test. So this is a test for the anterior talofibular ligament, which runs right here. Okay, so I'm going to cup the heel, and with 2 of my fingers, I'm going to pull the calcaneus anteriorly, and then I'm going to try and shift the rest of the foot superiorly towards the ceiling. Okay, so if we have any laxity in this ligament here, or if we've damaged that ligament, then we'll see, or we'll also feel, a little bit of a shift upwards, okay, with the foot. Our other special tests are going to be tests for the specific ligaments. So our 3 lateral ligaments and the tests that go with them would be plantar flexion plus inversion, which is going to test the anterior talofibular ligament. Then we're going to go into a neutral position with inversion. That tests the calcaneofibular ligament. And then if we go into dorsiflexion with inversion, okay, this one's a little bit tougher to get much of a range of motion because we're in full dorsiflexion. We're going to test the posterior talofibular ligament here. And then when we test eversion, which we have technically already done with passive testing, I'm going to evert the foot passively, or evert the ankle, and that's going to test the deltoid ligament on the medial side of the ankle. After you do your special tests, you would do palpation, and then you would be able to come up with an idea of what might be wrong.